Thank you very much, John. So I'm looking forward to taking part in this panel, and I hope you'll enjoy it as well. I'm going to start off the panel by looking at the big picture. So we're going to go into the future. We're going to look at the big picture of where digital health and personalised medicine is going and what that might mean for how we think about data. So hopefully you'll come with me on this journey, because we're going to be going from the genome right up to cities and everything in between. So we're going to cover a lot of ground. So I'm going to start off by talking a little bit about the NHS, which I'm going to use as my case study here. Its 70th anniversary is next year, and it's the first public health system, so an interesting moment to reflect on its history and where it goes. I'll talk a little bit about the transformational changes in medicine and technology, and what this then might mean for person-centered care of the future. And then following on from that, what might that then mean for what a 21st century healthcare system looks like? So let's get cracking. I've got quite a lot to get through, so I'll follow me closely on this journey. So Be Advisory, which I'm CEO of, is essentially looking at structured problems from 10,000 foot down. So that's what we do. We look at it through the eyes of different stakeholders, try and join the dots, paint the pictures. So, the NHS's 70th anniversary, what worked, what's changing, what needs to change in the future? Well, next year is its 70th anniversary. It was founded on the principles of that it meets the needs of everyone, that it be free at the point of delivery, and that it can be based on clinical need, not ability to pay. Now, anyone from the US here would recoil at socialized medicine. But this is the founding principles of the NHS, the first public healthcare system in the world. And it's the most cherished of all the institutions in the UK. If politicians play around with the NHS, we go crazy. It's our most cherished institution. However, like most healthcare systems, it's struggling. It's got healthcare spend overall is about 10% of GDP. And rising at about 5% a year. And as we've heard throughout this conference, we've got limited public spend available. So this is becoming a big political issue. And the reasons are, as everyone knows, rising chronic disease, obesity being huge in the UK, aging population, and a rise in medical costs. But what's interesting when you look under the hood, that 70% of the NHS's costs are now to do with chronic disease, which wasn't what it was set up to look for. So the balance of disease has changed. So when looking at the NHS and its strengths in the 20th century, it was largely focused on sickness, reactive to when people were sick. It was an acute care focus, i.e. you got disease or an infectious disease or an accident. It relied on people turning up when they were symptomatic to get treated. Standardized care, very siloed through the different specialties that formed out of it, and quite transactional. You pop up and see your doctor and then go and see him in 2 or 3 months again. However, with the balance of disease moving from being acute to chronic disease, this model doesn't work very well, and that's part of the reason it's struggling. So 21st century healthcare is going to address the challenges of illness for the 21st century, has got to shift to being more prevention focused. It's got to get better at being predictive and proactive rather than being reactive. It's got to laser in on how do we treat and manage people with chronic disease. Get much better at early detection. Don't wait until people have got a developed disease before intervening. Be far more integrated and be looking at this idea of continuous support rather than episodic support. So quite a lot of change there. So the NHS is trying to address itself to this new challenge. So for those of you interested in how healthcare systems are changing, one of the things the NHS has done is split itself recently into 44 different regions and invited the healthcare system in that region to focus more on population health. So the focus here is on population health, integrated care, looking at the social determinants, looking at inequalities and targeting resources in a more place-based approach. And they've done that by taking public health, primary care, secondary care, social care, and saying instead of running in glorious isolation, doing your own thing, you now have to come together and put plans together about how you're going to integrate care in your particular region, so it becomes a proper population plan. And these have been called strategic transformation plans. So all of them have been asked to do that, and they've all submitted them. But what's interesting is that the plan moving forward is moving more towards accountable care organizations. So they're now moving towards providing, or looking at providing a single fee for a regional organization to take ownership for keeping populations healthy, and that will fund the local hospitals, GPs, and social and public health. So a very different model from just funding transactional sickness to actually trying to create a systemic model to pull through a population health-based approach in the local regions. So they're trying to do that while maintaining a national healthcare service. It's quite an interesting juggling act. But how do these healthcare systems engage with what's a massively changing environment? As we've heard over the last day or two, precision medicine, genomics, eHealth, AI, personalised care, what incentives, what partnerships, these are all part of the very complex set of decisions that organisations need to make when they're thinking about how do they move forward from where they come from to this new population health approach. And what we've got back from a number of these is that they're very confused. How do you make choices in this fast-moving world? Because there's so many pieces to go for. What's the next shiny thing? Is that going to be the thing we should be investing on? Or is there something else that we should be looking at? How do you make sense moving into an e-health and a personalised medicine world of all the change that's coming through in all its various pieces? So what I've been asked to do is, working for one of these zones, is to look at a piece of work that looks 10 to 15 years in the future. So this is like the coolest project I've ever been asked to do. And essentially, they've said, Andy, look at where personalised medicine is going. Look at where sensors and medical technology is going. Look at where AI is going. And look at how our emerging understanding of how people engage with their own health. If you can follow those trends forward and get to the point where they intersect, that's something that's really interesting to us, because what they all seem to do is converge on the person. Personalized medicine is going towards the person. Sensors are moving from doing pathology in labs to doing pathology on the person. AI is looking at taking data and making sense of it in real time. There's a trend, if you roll the trends forward, it all points towards richer, deeper data coming out of people in more continuous real time. What does that world look like? What would health look like if we had all that data? How would people look after themselves? And with that vision, what would a healthcare system need to look like or need to reorganize itself to support this new future model? Because if we've got a vision, something we can see about where this is all going to, then we can start from where we are now and chart a course towards that vision. At the moment, without a vision, we're all flapping around in the dark, making all sorts of different decisions without really knowing where this is going to. So this is the project I've been given to work on. So very quickly, what are some of these transformational trends? Well, we've been looking through what would a digital future society look like in this future world. So there's lots of things going on there. What will be the future of AI? So I've been spending quite a bit of time with people like DeepMind and IBM. What's the future of medicine, and what will people make sense of with all of this information? How will people look after their health, potentially, if all this data is available to them to support them? So many of you, I won't dwell on this, are probably familiar with what's coming through in the wider technology space. So huge advances in genomics, huge advances in AI. In 2020, we're going to see drones that carry people. That's already been commissioned by Dubai from Uber, so that's going to be there. Amazon have got patents to have floating balloons hanging over cities with drones feeding up and delivering stuff to our homes. So in the not too distant future, we're going to be in a radically different world. So innovation more widely in society is marching forward at an ever greater pace. So people are going to find that technology is much more interwoven in their life. One of the big things that I'll just draw attention to here is that the likes of Amazon, Google, and Facebook have all committed themselves to a virtual assistant world. Actually, that's AI working for each person, bringing intelligent information together at each person. So the likes of Siri, Google Assistant, Alexa are just the start of what will become virtual assistants that will pull together data around multiple aspects of life and probably bring that to life not only through visual, but through voice and possibly even through holographic avatars in the future. So we're in for an interesting future. But medical technology is also really important here. So there's a brief slide here showing that as people, and I've used a bloke in his underpants here, so excuse me for that, as people move deeper into the healthcare system, it takes longer to get seen, it's more expensive when you get there. And so medical innovation is not just providing better tools within hospitals or better tools within primary care. It's actually saying, can we develop the technology that allows something that's done in secondary care to be moving up to primary care? Can we then develop technology that takes something done in primary care up to nursing care, social care? And eventually, can we take technology right up to the person themselves? So things like diagnostics, can be done at the person rather than having to go all the way deep into the system. And lo and behold, there's a huge amount of innovation going on at the moment that's doing just that, including some really interesting work coming through on having essentially a pathology lab in a chip embedded under the skin to measure in real time detailed biochemistry, which is going to profoundly change how we understand disease. Systems biology and precision medicine. One of the really interesting things about how disease is currently manifested and what breakthroughs are currently being made at the moment. Usually people present with a condition. So at the organ level, we have organ level specialists who deal with that. But the new breakthroughs being made in terms of genomic sequencing and biomedicine are showing that right at the gene level, we're understanding the process by which genes communicate through proteins to molecular networks that then feed up into cellular networks, into the organs, and then up into the whole body. So medical research is showing that we can actually determine and detect the precursors to disease. So we don't have to wait till people get sick. We can start to see the signs in which disease is either likely or starting to occur at the biochemical level. And new interventions and treatments are being developed to treat at that level. So we're coming to the point in the not too distant future where it will be a failure that people present themselves with stage 2 cancer or with any other symptomatic condition, because we will have the technology to be able to identify much earlier on the precursors to disease, be able to intervene, be able to treat before people get Alzheimer's or any of the other chronic diseases. By also looking at what else people are doing in terms of their health behaviors and the cities in which they live, what we're able to see is that in the not too distant future, we'll be able to take data from all points of that journey, right the way from the biochemical, right the way to cities. So looking at what's going on in the body, looking at behaviors, looking at the context in which people live their life, all will be producing data that allows us to understand not only how does disease begin and progress within the body, but what are the impacts and factors that affect how disease manifests, because we know that there's environmental considerations as well as genomic ones. So how does the phenotype express itself? We'll be getting these data points to start to model and show how this all works and pulls together. So data is the new oil, absolutely. So it's not just about data and technology, though. It's also about creating a new relationship as we get up close and intimate with people around many more dimensions of their life. And we must remember that we're dealing with real people here. If we look at the language we use in medicine, we often talk about the patient as though it's like a person who's been hollowed out and as an object that we administer clinical advice and do things to. And we talk about compliance and adherence in a very sort of patriarchal, power-driven model with these patients. And quite often we can dehumanize people through that approach. So what's really important is that we've got to see these aren't just patients now. We need to see them as people, as real persons. And inside that, there are hopes, dreams, fears. What does health actually mean? Is it part of my identity? Is it part of my existential way I think about myself? How do we entertain these conversations and support and treat people in a way that respects there's a very dynamic and important human relationship? We need to engage and pull people to want to take part in this, not do it through a traditional paternalistic manner. So it's going to go more from telling people what to do to coaching and advising them with lots more data available. So the future of person-centered care is really one where, as hopefully I've given you the clue here, that the medicine comes to the people instead of the people going to the medicine. With the sensors and data we'll have, it's a very different model of healthcare. So today, people have to wrap themselves around the complexity of the system. They have multiple relationships. The more sick they get, the more relationships they have to manage. The point of integration is at the person, juggling all these different bits of support. Even if there is a single health record behind it, there's different conversations happening. And chronic disease means that people, on average, spend 99.9% of their time by themselves and only 0.1% of their time with a healthcare professional. So there's no way coming to a healthcare professional can be the only way that we support these people in the future, because 99.9% of the time they are living by themselves. That is where health is happening or not. That's where they're looking after themselves or not. These are the moments and contexts in which health is lived. We need to support people in that mode. So what really comes through from the future is that instead of getting people to wrap themselves around the system, the medicine needs to go to the people. It needs to wrap itself around the people. And as you can see from the little diagram at the bottom, if we've got data from inside the body, on the body, about behaviors, around the body, we've got masses of data pouring out from individuals. We've got rich, real-time data on which to respond to. We cannot do that back at the surgery where we might see people once every month. This calls for something radically different. So what the AI and tech guys are saying is that very soon we're going to have the technology that essentially allows real-time data, lots of data, to be passed through machine learning and mount on top of that a virtual assistant or a virtual health coach that can live with the patient or live with the person to support them around a multiple number of health issues. So it could be around well-being, more in a virtual sort of health coach, or it could be detecting early disease where these chips, health chips, with data coming from them, can act almost like a guardian angel, watching out over your blood chemistry and vital signs to make sure that at the very earliest onset of disease, it's picked up and something's done about it. So this really paints a picture of a very radically different world. So what might a new healthcare system look like, and how would it deal with that kind of challenge? So this is a little bit of a busy slide, so I won't dwell upon it. If people are interested in this piece of work that I'm doing will be open source, so you're welcome to it. But essentially it talks about the virtual health coach, if you like, in the center, supported by real-time data and a personal data cloud that comes with it, which is all the data about you, owned by you, supporting multiple health conversations. And it could be health and well-being, it could be around episodic health issues, or it could be long-term conditions, or a more deep, richer engagement if it's social support and long-term conditions and you need to change your health behaviors. So it can be a very rich one. But what it will require is the healthcare system then to support that. Essentially got an agent of the system living with a patient, supporting them in real time. So it introduces a new entity into that future healthcare system. So if you imagine this health coach supporting people at different parts of their life journey, so the top bit there is essentially an end-to-end life journey, what you get is essentially different types of conversation at different parts of life. So it's probably more about health and well-being when you're younger and disease avoidance. It's probably around managing with long-term conditions as they arrive, and more complex conversations around more holistic support if social services or social care is required. The end result, why would this be a good thing? It sounds all a bit Star Trek, but why would this be a good thing? Might it be interesting? Well, it essentially offers the opportunity through better health prevention, early detection of disease, management of that disease, to extend the amount of the proportion of life which is lived healthy, and condense the amount of life which is lived in a sick condition, which for an individual is good, but also for the healthcare system, coming back to why might this future world be quite a different one, it potentially allows us to push that curve to the right and down at the population level by giving population statistics that push disease further to the end of life, so people can live healthier for longer and the amount of time that they do spend with disease will go down. So, takeaways. The NHS is in an unsustainable position, as great as it is to have reached 70 years old. Ageing populations, rising chronic disease. Innovation, massive new innovation coming through will bring revolutionary new ways to attack the problem. And to take advantage of this, the system needs to offer a person-centered view of this. But incremental change that's not focused and doesn't know where it's going isn't probably going to lead very far. In fact, it could make things worse as people add more technology onto a siloed, fractured system. And it really needs a vision around where is all this technology taking us? Can we see what comes out the other end that then represents something we can work to as an entire health system? So engaging politicians and key stakeholders in what this new vision will look like gives them a language, a narrative, a way of seeing what is all this digital health and precision medicine, where does it take us, what is the benefit of that when we arrive there. And within that, of course, there's a huge and bigger ecosystem opportunity, because in that future, technology is going to be central to the provision of medicine. And it's going to require much more in the way of partnerships between private and public sector. So just to finish off, we're in the middle of this report at the moment. We're interviewing multiple people from technology, from philosophers, from healthcare system, to try and build this notion of a future. We're going to be creating a coalition of the willing, if you like, a group of people from pharma, from tech, from the NHS itself, to harden this up. And then next year we're going to go to politicians and to healthcare leaders to really push a transformational agenda, a provocation to look beyond the electoral cycle of 3 to 4 years and start thinking, where does 21st century medicine take us? And what do we need to do as an entire system to have a common understanding of the future that can then pull through the innovation that we all know is desperately needed, and give people a clear understanding of why that should be the case. So, thank you for listening. I hope you found that interesting. If you want to know any more, please come out and grab me. All right, thank you very much.